What is depression? There are two types of depression, endogenous and exogenous. Although they are caused by different things, both are associated with these common symptoms: new or worsening negative emotions, loss of interest in activities, loss of energy, trouble concentrating or memory problems, change in appetite, aches or pains, and suicidal thoughts. Exogenous depression is commonly referred to as situational depression, and it is caused by tough circumstances, outside stressors, or traumatic events. It is more commonly treated with therapy, as opposed to medications. Endogenous depression, on the other hand, is caused by a chemical imbalance or genetics. It is commonly treated with medications or sometimes therapy, and occasionally both. Endogenous depression is caused by a chemical imbalance when neurotransmitter production goes awry. The 6 neurotransmitters that can affect whether you have depression or not are acetylcholine, serotonin, norepinephrine, dopamine, glutamate, and gamma-aminobutyric acid. Now, how do neurotransmitters work? They work by transmitting signals across a chemical synapses from one neuron to another. These neurotransmitters can affect things such as mood, sleep, concentration, memory, movement control, appetite, pain levels, and more. There are a few areas of the brain affected by depression. The hippocampus, which is smaller in depressed people due to stress suppressing neuron production. The amygdala, which has increased activity in those that are depressed. The thalamus, which receives sensory information and relays it to the cerebral cortex. And lastly, the prefrontal cortex, which is responsible for establishing positive and negative emotions. In most people, the left, which controls positive emotions, isn't working, making it hard to have positive reactions to everyday things. The demographics of people affected by depression are 8.5% of women, 4.8% of men, 7.9% of African Americans, 11.4% of Hispanics, 7.9% of Caucasians. The median age of onset is 32.5 years old, and an estimated 2.8 million kids aged 12 to 17 had at least one major depressive episode in 2014 alone. Lastly, the treatments for depression. The two types of treatments most commonly used are medications and therapy. There are 7 types of therapy that are most commonly used. Interpersonal therapy, a short, attachment-focused psychotherapy that focuses on resolving interpersonal problems and symptomatic recovery. Cognitive behavioral therapy, which is a psychosocial intervention that aims to improve mental health. Social skills therapy, a type of psychotherapy that works to help people improve their social skills so they become more socially competent. Psychodynamic therapy, a form of depth psychology where the main focus is to reveal the unconscious content of a client's psyche. Supportive counseling, where counselors give support, listen to people, and help them talk over their problems. Problem-solving therapy is a cognitive behavioral therapy aimed to improve one's ability to cope with stressful life experiences. And lastly, general therapy, which is non-specific, just going to a regular therapist and discussing your problems while working one-on-one to find a personalized solution or coping technique. There are 5 types of medications. Tricyclic antidepressants, which work by blocking the absorption of the neurotransmitters serotonin and norepinephrine. Monoamine oxidase inhibitors work by stopping the enzyme monoamine oxidase from removing the neurotransmitters norepinephrine, serotonin, and dopamine. Selective serotonin reuptake inhibitors work by blocking the reabsorption of serotonin. Serotonin and norepinephrine reuptake inhibitors work by blocking the reabsorption of the two neurotransmitters serotonin and norepinephrine. And norepinephrine and dopamine reuptake inhibitors work by blocking the reabsorption of norepinephrine and dopamine. Lastly, my sources.